I'm really proud of this work because this was work that was done with a very large international group of people who are just interested in FND. So, the problem was going into this study, what we were realizing is that we don't have really good epidemiological data in functional movement disorder at all, because in the tradition of most movement disorders research, the studies are parcellated based on phenotype. And so a functional tremor and functional dystonia and a functional gait disorder were kind of seen as these separate entities. And you have, good papers and good evidence in those specific areas, but to actually combine across different movement disorders and consider, could this represent the same entity hadn't really been done before. And also, there are some kind of larger case series in the literature now, but our collaborators worldwide are kind of sitting on these robust research and clinical databases they've been keeping on their own. And so we really wanted to engage people and say, look, what would happen if we just asked all of our collaborators, anybody who does this work in the world, who we know, who we can contact by email, if they would share just a very minimum data set with us. So all we really wanted was what was the age of onset of their FMD, what was their sex or gender, and then if you have it, what is the phenotype? And let's just see what kind of curves we could get from that and just look at the spaces. John Stone and I, who did the study together, kind of think about it as looking at the galaxy of FND with a better telescope, right? So we're not getting information around etiology. We can't even say that this is true population level data because it's clinic-based samples all amalgamated together, but we're able to look at patterns with a bit more resolution to kind of figure out what are the questions we should be asking next. Okay. So what we found actually is that if you collapse across all these different movement disorders, they all share a very similar curve of age of onset. And this is around kind of mid 40s, midlife is when functional movement disorder generally has its onset, with a smaller peak around 19, 20 years old. And that actually aligns with what we see in functional seizures, where they show a very different distribution of age of onset, where they have a really big kind of median spike or modal spike at around 19, 20 years old. And so, yes, these are both considered to be functional disorders, but they have very different profiles of age of onset and gender distributions. And so this kind of tells us like, okay, so we can maybe lump them together a little bit, but there are relevant differences between these different phenotypes as well that are worth exploring and asking more questions about. And so I really have to say, this was certainly, we collected and analyzed the data, but this was a very large effort with a number of international collaborators who really were super gracious and kind to share their data with us and take part of this project because they all felt that it was valuable. And so I think, especially these days, it really speaks to how science can bring people together to solve a common problem. And I think now more than ever, we need examples of that and precedents for that to keep doing this really kind of larger scale database-based work.